Thank you, Pat. I want to start my presentation with just getting a feel for what the impact of cancer in the fire service has been on all of you. Just a show of hands, if you or a firefighter you know has been diagnosed or passed from cancer. Show of hands. Thank you. It's incredible, and it's disturbing. With all of the information we heard this morning, with the show of the hands we saw here, doesn't it stand to reason that passing or improving presumptive legislation would be an easy lift? But we all know that's not the reality. The reality is we get pushback on every front, from the administration, from the state, from those who have to pay, from the provincial, everyone that has a stake in the game. I think the first step for you when you leave here is to have a true understanding of what your presumptive legislation is or what you want it to be. It's important to know that not all of the presumptive legislation is created equal. Those states and provinces that are highlighted in green have what we know to be presumptive legislation for cancer, but not all of them cover the same cancers. Those that are highlighted in orange have an eligibility clause that allows you to file a claim for cancer within the statute, but it is not a true presumption. And then lastly, those in pink are where we still have a lot of work to do. They have absolutely no coverage for cancer in the legislature. And it's often not about the evidence that we produce when we're trying to improve or enact presumptive legislation. I can overwhelm the legislature with reams of paper, reams of studies, many of the presentations you heard here today, and that does not mean you'll be successful at passing or improving your presumptive legislation. We have experienced this firsthand at the IAFF. We worked with the state that was looking to add additional cancers to their legislation. And we did exactly that, forwarded all the information we had. The chairman of that committee fought back at every step. This study says no. This information says you're wrong. It wasn't until that chairman read through the string of emails and saw in the signature line of our subject matter expert that they went to the same school. This legislator, in his real job, is a physician, and he went to medical school with our subject matter expert. Once that connection was made, they went offline. They discussed the presumptive language amongst themselves. And when they came back to the table, not only did we get the cancers we were looking for, but they added a few more. All because of the the relationship and the politics, not because of the evidence. So the groundwork starts at home with you, the affiliate leaders, working with your politicians, establishing that connection into political action. What works best when we go to testify is having you, the affiliate leader, lead the way. Yes, we can provide the science and the medical testimony, but unfortunately, it also helps to tug at the heartstrings. Have a member of yours that's been impacted by cancer be part of that testimony. But even with all of that, we're oftentimes not as successful as we would like to be. One thing I continually throw back, and I ask our members to throw back when they're testifying, is that this is not the golden ticket you think it is. There isn't a member who's diagnosed with cancer who wouldn't give back that presumption just to be cancer-free. You need to educate yourself on what presumptive laws are out there, some of the common statutory language. Find out what works in what you currently have or what you're trying to enact, and we can help. We have a website dedicated to this where you can look up the presumptive laws by state or province or by the disease of interest. Free and available to everyone on our website. So that's an assignment when you leave here today. Let's talk about some of the common statutory language. Some of it useful, some of it not so useful, and how you can apply it and your attempts to improve your language or add additional cancers. Number one is the pre-employment medical. You heard Dr. David present today and how he was able to get several cancers covered by it as a drug act. That would not have been possible if it weren't for the pre-medicals, pre-exposure medicals. We had medicals on every FDNY firefighter that responded to the World Trade Center and who worked on that pile for the months that followed. We were able to show in the post-exposure medicals that their pulmonary function significantly decreased. That was key in ensuring we were able to provide coverage. Everyone should be doing annual medicals at this point. I understand the concern about being pulled offline, but that doesn't happen. More often than not, you stay online for a longer period of time. Some of the language says you must be able to demonstrate that you were exposed. Well, that should be a no-brainer. We have plenty of videos, we have plenty of pictures that show the toxic environment we're involved in. So they step it up a notch and add a few other requirements. It has to be reasonably linked to the exposures. Well, as you saw, Pat put up about 14 cancers that we can say from the studies are reasonably linked to the occupation of firefighting. That doesn't mean it's only 14. Think about this. What we don't know is coming tomorrow. What study has not been completed yet? Before the NIOSH study, mesothelioma wasn't on there. It was only when that study was published, 30,000 firefighters, 3 old industrial cities, that we saw an increased rate of meso amongst firefighters. So what cancer is coming tomorrow that we're not aware of, that we don't have the study for yet? To step it up and make it just a little more difficult is now we have to say that the toxin you were exposed to is linked to the primary site of the cancer. So if you have kidney cancer, and these are the known toxins to cause kidney cancer, you have to demonstrate you were exposed to that toxin. The bar's starting to get a little higher, right? Cancer has to be caused with connection with a toxic substance. So we can say we know PAHs are present in every fire. But did you demonstrate it was present in the fire you went to? Think about how asinine that sounds. But those are the questions workers' comp is asking. And if you can't answer them, denied. There's also the defined period of coverage. This one's also very frustrating. So you have to be on the job a minimum of 4 years, 5 years, 6 years, 8 years, whatever the requirement is. But then they're only going to cover you for 5, 10, or so years after retirement. Let's go back to our meso. Latency period for a meso is about 30 to 35 years. So in year 15, I'm exposed. In year 25, I retire. And what would have been my 35th year, I'm no longer covered. And I haven't even approached the 30 or 35-year latency period. Denied. And of course, they're all rebuttable. And we thought, this is great. The clause to have a rebuttable presumption says they have to show medical evidence to the contrary. What's the reality? You filed the claim. They deny it. Now where's the burden of proof? It's back on you. It's not the way it was intended to be. This clause is something we're seeing come up more and more lately. If you want them to provide you the medical coverage and the benefits, you have to have skin in the game. What are you doing to prevent the cancer? Are you wearing your PPE? Are you decontaminating your PPE? What's your body mass index? What's your alcohol intake? They'll look at all those other lifestyle factors that contribute to cancer, and that's what they'll blame your cancer on. Education is becoming a big part of this as well. That you have to have a formal awareness prevention education program if you want to get presumptive coverage and have your claim approved. You've heard this course mentioned a couple times already, the IAFF online awareness course, available to anyone. Simple online learning. Take you a couple hours to learn some key tips on preventing cancer starting today. If you don't do anything when you leave here today, go home and make sure your members are taking this course. We're also looking at the gaps in the research and what else we can do on the legislative front to ensure that we have the data necessary to improve on presumptive laws, and more importantly, develop prevention protocols so that we never have to use that presumption. The Cancer Registry Act will set up a cancer registry specifically for firefighters to document and capture the data we need to show the link between the firefighting occupation and cancer. Develop those SOPs, protocols, and yes, improve on the presumption and medical coverage when you are diagnosed. Now, I don't want to talk about this subject for too long, but I have to touch on it. The IAFF affiliates approved a resolution at convention to fund some cancer research from the IAFF. And one of the areas we looked at are the toxic flame retardants that we're all exposed to. They're in the seats you're sitting on. They're in the carpet we're walking on. They're in the electronics we're using here today. We wanted to see what was in the dust in the firehouse that you bring back from the fire ground. You bring it back to the firehouse, possibly take it home to your families, and contaminate them as well. So we looked for a specific compound, BDE 209, a known toxic flame retardant. And what we found is there was a higher level of BDE 209 in the dust in California firehouses than there was in an e-waste facility in Thailand. Nearly double the amount. Think about that for a second. Known electronics with this toxic substance in it in an e-waste factory in Thailand has less toxic substance than a California firehouse. That's disturbing. You'll hear more about the legislative efforts there and what we're doing to combat that when Tom O'Connor comes up. In addition to the legislative front, we're also fighting this on the standards and codes front. The General President has made a commitment and doubled down on our efforts to improve standards and codes development and make sure our voice is heard when we're sitting at the table. We have more than 50 IAFF members represented on 75 different technical committees working on more than 200 codes and standards to protect our members. Additionally, we are educating our affiliates on what it takes to develop a code or standard. What's that process? So that you don't get confused and bogged down by the administrative side. We want you to understand how to do it, and we put it right here on the website for you to take those training modules online. You also have access to the list of IAFF representatives who are out there working for you to ensure we put the proper provisions in these standards. We're attacking this on multiple fronts. We're tired of the excuses. We're not only going to suggest that you have a source captured diesel exhaust system, we're going to mandate it in the codes, that every fire station now must have a source captured diesel exhaust system to get those harmful toxins out of the fire station. A known carcinogen, diesel exhaust. Why aren't these in every single firehouse? We're looking at the PPE, not just from a design standpoint, but what are we doing to decon the PPE? How clean is clean? We've all heard that phrase. We need that answer to make sure that we're giving you the very best. We know from the fluorescent aerosol simulation tests that those particulate matter get through your PPE and onto your skin. Those highlighted areas are areas where those contaminants are getting on our skin and absorbing into our body, and we have to stop that from happening. We have to make sure that the apparatus we ride in remain contaminant-free. I like the example of the gloves on and off and how careful we are on the EMS side, but not on the fire side. The same could be said for the apparatus. We'll throw our contaminated gear up in the back of the apparatus, jump in with it, and close the door. Won't think twice about it. But transport a patient in an EMS unit, and what do? Well, you have to decontaminate before you go back in service. It's just dangerous, right? Why aren't we doing that with the fire apparatus? We need to bag the gear, not throw it in the apparatus. And the last thing I want to hear anymore is we need a second set of gear. You do not need a second set of gear. You need a clean set of gear every time you put on your PPE. Finances should not be the barrier. A second set of PPE will not get all of us through a shift. We know that. You deserve a clean set of PPE every time you roll out the door. When you bring that gear back, you have to have the proper cleaning methods. An extractor that spins at the right velocity to remove the particulate from the PPE, not just mom and dad's wash machine. That doesn't work. We need to make sure that we have a clean, toxic-free environment to store that gear, separate from the living quarters, so there is no cross-contamination. And we're embedding these things in the codes and standards. You need to make sure that you have the means and the time for personal hygiene to take care of yourself. These remarks that you can't go out of service to take a shower because you have to run the next call, it's ludicrous. You have to be alive to run the next call. You have to get those contaminants off of your body so you can continue to run those calls, go home to your family, and have a healthy retirement. We heard that the wipes remove 50% of the contaminants. Isn't that a good first start? These should be common on every piece of apparatus. It should be embedded in your protocols. And it's going to be, because we're embedding them into codes and standards, no longer relying on the administration to put it into SOPs or the general orders. We're going to make it mandatory. You've heard these numbers thrown out several times today. 63% of the names that went on the IAFF wall in that 15-year period, 2002 to 2017, were because of occupational cancer. But that doesn't tell the full story. Many of our affiliates wouldn't submit occupational cancers as a line of duty death. Many thought for a long period of time that you had to die in some traumatic way to be considered a true line of duty death. And then they would walk in front of the legislature and testify and lobby for presumptive language, only to hear, if you're not willing to break out a hammer and chisel and put it on your wall, why should we pay you lifetime benefits? Makes sense. So now our affiliates are including occupational cancer. So what does that picture look like for 2017 alone? 74% of the names going on the wall are occupational cancer. It's a beautiful memorial. You passed the resolution to finance the rebuild of it, and it's a beautiful site and a fitting tribute to our members. I won't deny that. But if you don't leave here today and take some of the information that you're being provided and start to make change, we'll have to come back for another resolution and another expansion. And none of us in this room want that. This is either nice to have information, or it's something you're going to do something about when you get home. I hope it's the latter. Thank you.